Hello, everyone. So I'm Norman Sabbah from Telemedicine Technology. We are a company building some digital tools for clinical research. And the topic I will cover today with you is, do research need to get data directly from people? So the sites which are running clinical trials are overwhelmed. There is an increased number of studies, lack of awareness of all studies and sites, the spread of study information across various supports, the complexity of selection criteria, and many HCPs are not, healthcare professionals are not involved in the research activities, and there is still the time prioritization practice against research. Hence, the recruitment of patients for clinical studies delays occur. However, patients are there, but only 0.2% of them are being referred to a study according to the TUF study. So what are the current solution landscape? So there were historical databases, the past clinical trial record, electronic medical record, market data. But in the past, the data were usually outdated. The competition was not considered, and no involvement of the HCPs. There were also all the promotional efforts, so the advertisement and selecting of call center, or the communication that could be delivered to the patient about the clinical trials, but also the patient engagement materials, patient advocacy groups, and of course, social media. But still an increase of workload for HCPs and referral of not relevant patients, and the first patient selection is not always done by investigators. So the recruitment challenge remains major. In the frame of the EHDS project, which has been already introduced to you, we try here to explore the business use cases in which the EHR format and the EHDS button demonstrate the value for clinical research with a patient-centric approach. That's where we shift a bit the perspective of recruiting patients with the patient really at the center of this process. So we worked on different business use cases, patient pre-screening, but also study feasibility, which is really the evaluation of the sites that may actually recruit, the selection of the site that may recruit for clinical trials, but also study support, where we worked on filling directly the ECRF for clinical research. But today we will focus on the patient pre-screening, as that's the business use case where we made the most progress so far in the frame of the project. Let me explain a situation where the pre-screening can be used through the EHDS button. So let's consider Paul, which is 37 years old, with an active Crohn's disease, who is under the treatment of azathioprine and who was previously intolerant to infliximab, and also suffer from iron deficiency anemia. So let's consider that this patient actually used a PHR app, so a personal health record app, to be able to share his IPS internal patient summary to a pre-screening tool. So Paul is willing to know if a clinical trial is compatible with their health condition. The results on the PHR app would be that he has 80% of compatibility with several studies, including FAST, in 3 different hospitals in France, Paris, Lille, and Lyon. And based on these results, the data will be shared directly to the hospital, and the critical pre-screening information validation can be sent through additional questions. For example, let's consider that this study requires 3 additional colonoscopies, and this information could be checked with the patient before getting him to the hospital to be evaluated for his full eligibility to the clinical trials. Finally, the patient is coming from the on-site visit. And okay, it's running directly. Just wait. And now sorry about that. Now I will show you a demonstration of this business use case and how it could be directly used by a patient. Okay, so the patient can connect to the Health for You. This app has been developed by a team in Cyprus, which we worked with to make this demonstrator. So they use their smart health link, which includes all the IPS data, so the information about the treatment the patient took, but also the different complications, the disease. Finally, this link can be actually copied and shared directly into our app, City Scout. So the patient click on City Scout. He will copy directly the link, the Smart Health link, including the international patient summary. He uses a code. The system will analyze the IPS and present the relevant information regarding this patient that could be useful to prescreen him for a given clinical trial. Here we see the same information I just showed you before, the age, the disease, the activity. And finally, the results. Different studies are compatible with this patient. And of course, several hospitals where those clinical trials are running. So at this stage, the patient can choose the site where he wants to go. Let's consider that he will go to Mickey Institut Privé, which is a site in Paris. He click on next and then provide his password and create an account. So this information could be shared to the site so it can contact him to organize the visit at the site to evaluate his full eligibility for the clinical trial. That's all. Finally, Paul is eligible and agrees to sign the ICF, the informed consent, and is included in FAST study in Paris Hospital. Thank you for listening.
Thank you.